Hello, everyone, and welcome back to another episode of Office Hours. I'm Stuart Newsom, your host, and this week we're revisiting a segment of a comprehensive session I gave at the recent AAPC HealthCon conference called The Evolution of Revenue Integrity. This session covers the pivotal role that revenue integrity plays in each area of the RCM process. And by the end of it, you should be able to understand the role of revenue integrity, discover how integrating technology like AI and automation can improve your practice, and identify strategies for minimizing revenue leakage. We hope you enjoy this session. And as always, make sure to reach out to us if you have any questions on this session or on RCM in general. Thank you and enjoy.
Everybody has different interpretations of the revenue cycle. I may have missed some things, combined some things in here, but we're going to walk through them one by one. It all starts with patient access or registration. Some people have the same personnel. If you're in a small practice doing patient registration or patient access, some have large departments where it's patient access. In essence, if you don't get the patient's insurance right, you're definitely not going to get paid, right? It's going to be a bump in the road. You'll want to make sure those authorizations and services are in place. This really sets the stage. This is the foundation of where revenue cycle really starts, is understanding who's going to be responsible for paying this. How much is the patient responsibility? How much is the insurance responsibility? And are they even covered? Are we even in network for this patient? Has the patient switched insurance and they didn't tell us? That's where a lot of technology can really help with this. You can have some direct connections to payers. That's how you can actually overcome any cyber attacks that happen like with Change. If you have vendors that can go direct to payers, they do exist. Clearinghouses are great, very efficient, but you can go direct. It is possible, particularly with prior authorizations. It can definitely speed up the process. You can have bots. Now, AI, I won't go on a tangent with AI. That could be a whole nother hour of what I have to say about artificial intelligence. But part of that is bots, where you can have some automation built in for repetitive routines, such as multi-factor authentication. One of the things that a lot of the payers have done is when you used to be able to log onto their site, you could check for eligibility and verify the insurance, even go do some prior authorizations. It was easy. You just logged in, you're there. Now they want two-factor authentication. So you can actually build a bot. And we did that in Infinix, where we built just one simple thing. You build a bot that kind of takes care of all that in the background, where you still can get to the site. And it's still doing that multi-factor authentication, but it's doing it in the background. So it's still a lot of security involved, but you don't have to go in every time, because who's done two-factor authentication, right? Just about everybody in the room. It's frustrating, right? It's very aggravating. You're like, oh, not again. What are we doing? Again, automation for the insurance discovery and intelligent payer mapping. I kind of mentioned this earlier, where the patient is not exactly forthcoming with changing their insurance because they just want to get in the door and because they're sick. They don't want to fill out that form they get handed every single time, right? But there's a reason you give them that form, because, hey, has your insurance changed? And if it has, is it mapped within the EHR? Whether it's Athena, whether it's Epic, whether it's Meditech, they all have different versions of their payer list. They're not very consistent with what they call their payers. Even clearinghouses have various different lists they're all going to the same payers, but they just name them differently. So that's why it's important to have something like intelligent payer mapping. So AI can do that as well, where it automatically routes. It finds the patient. It automatically understands this patient belongs to this payer, and it'll take care of it for you. And then you could have predictive AI. One example of that I have here is the need for even a prior authorization. That when a patient is presented with certain procedure and diagnosis, then it can actually predict whether you even need to go to the trouble of looking for a prior authorization. Because a lot of practices we talk to go, well, the rules change so much, we don't even know if prior authorization is necessary. For most part, you can know it by heart, but when there's a change, all of a sudden you get a denial because you can get a prior authorization. Predictive AI can actually play a large role in that. Next is patient collections. How many of you have seen an increase in patient or self-pay in your practices? But the patient is now soon to be the largest payer in the country. It's especially with high deductible plans out there. So there's a lot of burden on the patients for those who are able to pay and those who aren't able to pay. There's a lot of assistance you may want to apply or reference for them. Do you have processes in place to make sure that you're collecting that money up front? I've been at this so long, I can remember when, swiping a credit card was taboo, before the patient came in the door. Now it's kind of normal. How many swipe credit cards for co-pays before the patient's seen, right? I can remember probably about 10 years ago even, doctors were like, my patients will not swipe a credit card in my practice, but now it's standard practice. So technology can actually help with this as well, accurately estimating the patient responsibility. And there are a lot of solutions out there that can do patient estimates and even patient payments. There are vendors out there that can do this, but many times they don't really actually get it right. So it's very important that even, especially during the insurance eligibility process, it's a part of that previous stage that I was talked about earlier, is you want to make sure that you're not only knowing what the patient responsibility is, but communicating it to the patient, what their responsibility is. And so they clearly understand this is your responsibility, and having a way of making a payment. I've spoken to a couple of doctors at MGMA that's their practice now. They will not see a patient till it's paid in full for the patient. The staff freaked out. They're like, we're going to lose patients. He goes, I know, but I don't want to lose revenue. So he actually saw an increase in revenue and did get a decrease in patients. And so I was like, what you're telling me is you saw less patients and made more money. He said, yes, because he wasn't chasing that revenue. Things weren't going to collections. He essentially doesn't have a collections department anymore, because there's the expectation that the patient's going to pay. He has a website on his website, a page on his website where they can go in and make payments. They can go in and select how to pay. It's all kind of automated in the background, so it's very helpful. So with the next is the patient encounter. Yeah, and this is where the patient's actually being seen. I'll go over this really, really quickly, but this ensures clinical documentation is accurate. I think everybody in the room understands this with clinical documentation improvement. A lot of the efforts that AAPC has made for this has really set the standard, in my opinion, for this. Provides clinicians with real-time support to capture detailed specific documentation. And yes, AI can help. I'm a little scary with AI making any kind of diagnosis or decisions, but it can bring resources to the provider where they can actually have some machine learning to analyze encounter data, so they can actually look at trends and things of that nature. You can also automate delivery of care instructions, what the physician needs to deliver to the patient for them to adhere to the standards of care. Yes, there was a question or a statement, probably.
I've heard through all the sessions that I've been through about vendors helping the patients with medical needs. Who are these vendors that can help them?
Yeah, well, I've actually just got recently, in the last couple of weeks, a vendor called Health Bridge. I don't know much about them, but I know that they are an organization that helps patients pay their medical bills with no interest. I don't know how they make money, but they were looking to partner with us for prior authorization and insurance eligibility, where they were going to use our technology to go in and basically they fight for the patient on behalf of the patient, not necessarily on behalf of the provider. So they're fighting with insurance on behalf of the patient, make sure the medical bills get down. Part of the process of helping them is to make sure that, look, this is what they're responsible for. They shouldn't have to pay this. And that happened a lot in COVID from personal experience. I mean, during COVID, my wife got sick and she had a cardiology effect from receiving COVID. And we got a bill from the cardiologist, and they didn't like me getting on the phone because they're like, man, this guy knows what he's talking about. But it was all the cost sharing. It was all waived. And with Blue Cross Blue Shield of Florida, which is what we were on at the time, they were adhering to Medicare's provision of cost sharing. which all copays, deductibles, everything was associated with that. And it ended up, winning and getting it overturned. But I think that's what this company does, HealthBridge. Again, I'm not advocating for them because I don't know them in detail, but it just so happens that just recently they gave us a call about using some of our technology with prior authorization. Sure. Next is documentation, coding, and charge capture. I think this needs to go unsaid with this audience. Some audiences, you wouldn't believe that this is the first time they've ever heard this, right? Particularly providers. But services rendered are accurately documented and captured for billing. I mean, that's just number one rule, right? You want to cross-check clinical documentation to prevent missed charges or discrepancies that could help revenue leakage. Involves ensuring that clinical documentation accurately reflects the care provided and that coding is compliant with current regulations and payer policies. And accurate coding is critical for justifying billing claims and avoiding denials for insufficient documentation or coding errors. So the way technology can help with this, I know that's a lot going on there, but you can have machine learning that basically analyzes the clinical documentation to suggest a more appropriate billing codes. And this is nothing new. We've had CACs out there forever. I never was a big believer in them because sometimes they can deliver false positives. Some wrong coding still requires some human intervention. It's getting a little better. Again, you don't want AI to determine the codes based on medical decision making. But the whole point is to reduce the risk of errors and subsequent denials. And the next portion feeds into that, where you have automation and bots that validate charges for errors for making common corrections. So there is technology out there right now that will take the documentation or take the charges from the EHR, and before it goes into the billing system, it's in front of a coder and it scrubs every single one. So how many in the room have your coders, or if you are a coder, do this, that you see every single encounter that comes from the EHR before it goes in the billing system? Okay, so one particular company did a study that does this technology, and they found that about 33% of the time, those charges are correct and didn't need a coder's attention at all. And it was all done through AI. It was all done through automation, where they just sent it through. It's like, this is good. So that's a 33% reduction in your work. Would that have been very helpful to see more encounters? Another was where they had routine corrections where they could automate these corrections. And it was another, I think, 25%. So somewhere between 30 to 40% was where the coder actually got the attention to work these complex encounters that needed their attention. And when I talk automation, I'm not talking about making corrections automatically that are complex. I'm talking something like, something I see very common is the physician codes a 99204 for an established patient. And that's pretty easy, right? You can automate that to change it to a 99214. Coder doesn't even have to touch it. Just let it go. If it's correct, let it go. And only focus on the percentage that needs your attention. And you'll see exponentially the amount of encounters a coder can handle per day will jump through the roof. I've actually seen it with my own eyes. It's a great company called White Plume that has that technology, and they do interface with many EHRs. You can have AI machine learning analyze encounter data to identify trends. Now, this feeds into that, where it will look at what coders are correcting and analyze and ask the question, can we automate this? And you have a human that may agree, yeah, we can automate this. So it could be something that's so routine where you see this problem that the coder's touching it over and over and over again. So it's always trying to improve the efficiency of the coder. It's to augment the coder's work rather than try and replace it. Does that resonate as being very helpful for anybody? Claim submission focuses on accuracy of claims before it goes to the door. This is the traditional, when people think revenue cycle and think about preventing denials, this is what they think of. It's always back end, the claims going out the door. Use a claim scrubber. How many have a claim scrubber? Yeah, most of the people in the room have a claim scrubber. Not all claim scrubbers are created equal. You got to have a really good claim scrubber that adheres to the regulations and the guidelines, but even the best claim scrubbers out there, you have to configure, you have to modify based on certain plans, based on certain payer mix, because they're not all perfect. If you're relying on them to be perfect, so that kind of technology can take you so far. So that's where some RPA bots things can kind of look at some of the issues and do those automatic corrections for you, where you're actually looking at things that maybe could be an easy fix in the claim before it goes out the door. You can also have real-time insights to status of the claims, including accepted, pending, denial claims, or allowing for immediate action. So when that claim goes out, you need to understand, well, what's the status of this claim? Why is it taking so long to get paid? You can actually create automations that feed back to you what that status is. And you can also create demographics and KPIs where you can look at and say, what is my payer mix? Which payers take longer to pay? Which payers are good payers? You have bad payers, right? And good payers. So you want to pay attention to your good payers, the payers that give you the most revenue and the payers that are easy to work with. That's where you focus your attention. And so the technology like this can help you with that, where you have to focus so much on the bad payers because they're going to be bad anyway. And so they're going to be very resistant to making those payments. So you'll spend twice as much effort on those. Sometimes they're smaller payers. They're part of your smaller mix. So my suggestion is you take your 5 top payers, and that should be your primary focus. Any denials that come from over your top or less than your top 5 payers, I'm not saying I'm not saying to ignore them. I'm basically saying that they shouldn't demand all your attention that you give to any of the other payers. Then your remittance processes, you involves analyzing remittance advice and payment accuracy against contract rates, identifying underpayments and processing adjustments, the steps that ensure that payments received match the services billed and contracted amounts. So essentially you can build RPAs, that's robotic process automation, and so it's basically robotics or bots that determine that they can actually look at the root cause. How many spend a lot of time chasing after root causes? And then when you get there, it's not exactly what you thought it was, right? So you can actually build automations for that, where it can look at trends based on CPTs and diagnosis that are built over time and really look at that information. And then you can build automation for payment posting, for adjustments and denials, for speeding up your reconciliation. You can even build machine learning and AI to where it can tell you and prioritize which denials you need to work rather than trying to decide. Because the old-fashioned way is what? Which ones are going to age the quickest from timely filing and what's the largest amount? And many times you'll spend more time and resources on those where an AI can actually tell you, well, you're actually going to get more bang for your buck if you work these 10 denials today. Leave the others alone and you'll make more money. I've seen that with my own eyes as well. Denials management, it's part of what I've already said as well, plays a crucial role. I think there's the virtual attendee mentioned this as well. You want to identify root causes, denials, appealing unjustified denials, implementing corrective actions to prevent future denials. Some of the ways that technology can help with this is, machine learning, predictive AI to prioritize claims. I said that earlier. Automate work assignments. When you're trying to assign different queues, who's going to work what denial, you can actually set that up in the system and it'll automatically assign the work to whoever needs to be assigned. And you can even track progress of those working those claims. You can even be agile and change that up somewhat. And you can utilize RPAs to build edits utilized at the EHR and charge capture levels to proactive management and denials prevention. So again, you're making sure the CARCs and RARCs are working for you, building smart edits, put them to work. Just like the definition of insanity, I think I heard that yesterday too, where you're just working that denial over and over again. It's the same CARCs and RARCs, and you're finding the same root cause. We'll build something early on in the process. Try and find out where in the process the breakdown is, and then insert an edit there, insert an automation there that can take care of that. Because the human factor is probably the top reason why denials are made, human error. Not saying that automation is perfect or AI is perfect, but we all know computers can work much faster than the human brain. Underpayments and recoveries for appeals. It focuses on pursuing appeals for denied claims and addressing underpayments. This involves negotiating with payers, providing additional documentation. If you sat in on your session yesterday, this slide basically covered that whole session. But you can generate appeals letters, automatically. Generate those templates. Address specific denial reasons, saving time and insurance consistencies. Somehow I know that the tips in that session that we learned could be built into where it could be some automation. Because as I was listening, I was like, yeah, you could probably automate that. You could automate that. And even though these are great advice and this is the way it needs to be done, but how can we make it faster? What can we do that a human doesn't necessarily need to touch, and where the human only touches what they need to touch? Reporting analytics, very important to pay attention to your KPIs and make sure that they're all being reported from an EHR. How many have a different EHR and a different PM system in their practice? And I know they have interoperability's come a long way, integration of those two probably, but many times they don't work together very well. A lot of larger health systems that we find and clients that we have, their large hospitals have many EHRs, especially with the ambulatory settings that they own. So you have to have a system and a platform that can pull all that information from an agnostic approach, where they're looking at all this data at the payer level, the procedure level, as well as those procedure groupings and CPT codes. Enables you to drill down into which payers are giving you the most problems, which CPT codes are giving you the most problems, and you can identify, okay, not from a root cause perspective, but what's causing these denials.